Hi everyone, Dr. K. It's midweek, start of the week, I should say. All right, it's an update on life and fertility. I'm going to stick to the fertility journey because that's what I know better than anything. Hello to everyone. Kindness, I miss Mudu. Hello, Star 4012. Hello, Amanda. Aini, how you doing? Karen, Olive Mac, hi. Going fast today. Amanda, Meg, good hello, good evening to everyone. A really, really awesome and amazing day. Very, very busy at CNY, Albany, Syracuse for retrievals, transfers, and we're grateful to everyone that is making the commitment and the journey to us. We are committed to you guys, and there's a lot going on. We've been very busy. The summertime is going to be exceptionally busy for all of us, and we're working our best to organize it in a way that we're able to get everyone in the process. And so we're working on possibly some people going on the birth control pill for a few days to a week or two at max. But we believe that we're going to be able to get everyone in and flowing nicely. Organizing, we're getting Buffalo up soon. Colorado is like in the mind, it's almost there. And so really grateful. Hey Cheryl, hey Will, Marianne, Nat, how you doing? Lauren, Sadati, hello, how are you doing? Nikki loves music. I get my guitar and I can't on the piano a little bit, mostly I love the guitar. And it's just really a pleasure. I threw out a little bit of a short live this morning and just calming all of us that the holding off 2 to 4 weeks, that's not happening in that way. So I think a little bit of miscommunication on our part, but the intention is that we kind of really know who's on their way in, what we can do to make sure you have your medications, your plans, a basic understanding of the process as best we can, so you are not tripping and we're tripping, and we really get you to the best spot possible to improve your odds of a successful outcome. And whether you're doing IUI, IVF, fresh or frozen, your eggs, donor embryo, frozen embryo, or you're working to conceive naturally. And don't forget, if you find yourself suddenly pregnant naturally, we want to intervene on that and making sure you're getting all the appropriate medications. Let's see. Hi, Dr. Verdial. She will do. Dr. V is going to be back on doing the lives for all those Spanish speaking. We were just kind of holding off for the last week, but I think we're going to dive back into it this week. A lot going on in the world, and we just kind of slow down a little bit. And sometimes we all need to do this, take a little bit of meditation, prayer, visualization, and remember, don't lose faith in the face of challenge every day. Hello, Portia Brown Ridge, how are you doing? I have one fallopian tube and haven't gotten pregnant since it got removed. Again, even though one's gone, the other one might look normal, but it may not be normal. There may be some very subtle microscopic inflammation or damage to the fimbria or the cilia within the fallopian tube, and that's where IVF may come in. And the other tube may also need to be removed as an option, although another option is to think about a 30-day, 2 to 4 week trial of antibiotics and a fungal antiviral. And don't forget Kiltz's keto. Bacon, eggs, butter, beef, and ice cream in one meal a day. And if you eat the carbs, or vegan or vegetarian, cook the carbs well and add the fat. But you need to look at that other tube. Maybe it's blocked up. Laparoscopy, hysteroscopy for endometriosis. Clean the uterus out. Really can be helpful. Keisha, hi. And always, we want to lead our lives with faith. That's so important. And we're learning together every day that if we can learn together to honor each and every person, honor ourselves and honor others as we would want to be honored, even sometimes when we think we're not being honored, we lead with honoring, love, and kindness. That's where it all changes in our lives. Seeing why I tend to defer to our endo for thyroid TSH concerns. My TSH came back really low Typically, the really low ones, we go to your endocrinologist if you have one. If you don't, but we want to check your T3, T4, free, and bound, and your thyroid antibodies. So simply looking at those can be really helpful. And before you need to rush off to your endocrinologist, because we do some of those also. Caitlin, 6318, I missed the 0, but it's there. Rama Ganji, hello. Let's see, Marin Catherine, how are you doing? Girly Gamer, hi. Gamer. Endometriosis grade 4, so that's severe endometriosis, which is an inflammatory condition inside the intra-abdominal pelvic cavity. I believe it's a bowel disorder as its source. AMH of 1.16 will get natural pregnancy. Could you please? You could get, look at everyone and anyone with open tubes, a normalish uterus, normal sperm, regular cycles, absolutely believe and have faith that natural pregnancy is in your life. And in the dream, that's how it unfolds. But absolutely, even with severe endometriosis, I've seen pregnancies happen. Blocked fallopian tube on one side, hydrosalpinx. Natural pregnancies can occur, by the way. So don't lead with no way. Just lead with I'm on the way and it's happening. I know that, and that's the power of positive thinking, by the way. Lexi, hi. Healthy pregnancy, awesome. My 4-week HCG 170. Listen, you gotta have faith and not give up. These numbers sometimes are deceiving. Data is doo-doo. Lies, damn lies, and statistics, as that famous author Mark Twain once wrote. Miss M. Smithers, hello. Alex, how are you doing? And everyone, it is really my honest pleasure, and I can't imagine doing anything else in my life, and really this is such a joy, and I know it is very, 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 very difficult, and we're here to help guide you, and even connecting with us is so challenging right now. Just this wave of post-COVID is really being a challenge for all of us, but we're going to stay on it. We're going to keep doing our very best for everyone to answer questions, look at new and different ideas. Remember, what you put in the mind, faith, what you put in the mouth, food, matters in the vibration of this human Ferrari, the lioness and the lion. That's really what we are, the temple, not an amusement park. So be very, very discerning of what you put in this beautiful, amazing organism every single day. All right, we're Motivation 4012. Again, we have to lead with patience in the path to pregnancy and a baby, by the way. Let's see. Let me just raise the sound up on the, can you guys on the Facebook, someone just noted to me that maybe the sound isn't so good. If I need to change it up, please let me know. Trigger, good luck. Chris Ann, hey brother Ray, Faith, and keto. Hey Natalie, how you doing? Cycles start naturally. Well, keto, 1 meal a day, slow it down, cool it down. Inositol, by the way, can be very helpful. We're coming out with our new molecular fertility supplements, so we're really excited about that. But sometimes it doesn't happen naturally. You don't need to have that natural cycle. Get an ultrasound blood work, look and see what it's like. And sometimes it may take a little bit of estrogen and progesterone, or just progesterone to help with that, by the way. I'm not a big fan of the birth control pill, but it's another way to do it. And also I'm reminding all of our team members, estrogen priming for at least a week prior to stimulation if you're doing a priming at all. We typically have done human growth hormone, DHEA, but I'm really beginning to see that we should be adding a little bit of estrogen, 2 milligrams on the patch, either oral or vaginal estrogen, I think can be very, very good. It is a village, and it's a global village. size, shape, age, color. We are all a family of the human condition. We need to be doing our very best to bring love and kindness to all of us, acceptance of all of us. And remember, the most important person to love is yourself. Look in the mirror every day, start the day with that. The unfolding of the vibration within your body, it just unfolds in so many ways. Hey, Mrs. Griffin, Brooke, Ms. Ashmo, hello, Kalim Minaj. I just mess up the words sometimes, and please, it's my dyslexia that I used to have, by the way. Gearing up for second FET of endometriosis, the best to do hysteroscopy DNC or a hysteroscopy and scratch. The hysteroscopy DNC and the hysteroscopy scratch are really the same things. And don't forget the antibiotics for at least 10 days to 2 weeks. I think we need to be a little more aggressive with that. And if you're doing a scratch, a biopsy, even an IUI or a wash, a few days of antibiotics, I think can be very helpful. Cycle July 26th, anticipate being okay. Yes, we are really working to, my embryology team in all levels are really rocking amazing, and just gratitude to all of them. The unsung heroes, listen, we can do all the medical stuff, all the drugs, get the eggs, but we have to have a really experienced embryologist, and our teams at CNY Fertility are rocking. Our Buffalo team's coming soon, and we're really excited about that. But from Idaho, absolutely, we'll be moving forward, by the way. What do you do if my baseline retrieval is tomorrow, Wednesday? Will I be at 99%? You're going to be able to start, by the way. We're in a rolling system, and as we get Buffalo and Colorado open, it's going to open up more opportunities for your retrievals to happen in a much more timely fashion. Del Banks, how you doing? Increase odds for multiples. Usually Clomid is about the 5 to 10% range when you're doing a Clomid IUI cycle or intercourse versus a standard. But it's low enough, we believe. Beginning is there a start date for Colorado? Not yet. You're right, it's much closer to California, and I'm really excited about it. I'm looking at we should have all the paperwork done very soon, and then we got to just make sure all the dots are placed and the cross against the line, the T's as they say, are in the right place. But it's coming, and I'm hoping for July, August 1st at the latest. But they're already rocking and rolling. We may just say, like, open the doors, here we come. Drive there. You know, we realized that I did my training in Colorado for my residency. My daughter Pilar was born there, and really excited to be coming back and working there. I do have a Colorado license, and I'm going to try my very best to get out there and work with Dr. Magarelli and the team to do some retrievals and transfers, and just share some ideas for everyone. Atlanta next year, that's my work, and I'm really working diligently. Dr. Rudy Alice is really doing an awesome job. Get her, some other team members that are trained, but it'd really be a great thing. And we know that coming up to upstate New York is really easy for so many people, and they think we're down in New York City, but really we've opened up so much, and we're really grateful for all those taking the time. Embryos, we will be able to transfer the embryos to Colorado at a nominal fee for the cost, by the way. So July, August, yes, that's what I am. And we're all visualizing, and we can only do so much in all of our locations. So sometimes it's that day is booked. We're going to have to help you get out to one of the other places. But again, 99.9%, we're always able to fulfill the place you want to go. Unexplained secondary infertility of one child and have a miscarriage 4 times with in 2.5 years. I have had several tests and all come back normal, no issues. My first pregnancy, can get pregnant on my own, miscarriage. Okay, so Brandon, Brittany, Posse. All causes of fertility issues are nearly identical. Inflammation. And inflammation to the sperm, the eggs, the embryo, the uterus, tubes, the entire environment, and the entire body. So this is where if you go to my website, drkiltz.com, or go to Amazon and look at the Family Building Guide and look at the Keto book, you really get some insight into how to reduce inflammation in your body. I do recommend things like metformin low dose or Ovasitol low dose aspirin, and it may be reasonable to start some Lovenox or heparin with that positive pregnancy, along with intralipids and a low dose steroid potentially. We also go to the big guns like IVIG, Humira, even LIT therapy, and you might consider a laparoscopy, hysteroscopy for endometriosis. I think that could be really helpful. We've seen so many people do a laparoscopy, hysteroscopy, clean things out, do a 1 to 4 week course of antibiotics, and voila, you stay pregnant. But progesterone supplementation, aspirin, and Lovenox, even for what we call idiopathic infertility, which is another name for unexplained, which kind of means we're kind of idiots because we're so blind to the fact that it's all inflammation due to a high plant-based diet and a low-fat diet. I know, it seems crazy, the concept and ideas we're sharing, but I've seen them work. Lisa Renzo, how are you doing? Mrs. Mallory, hello. Thank you, Girly Gamer, for my saying something about the advice. I'm learning from you guys. I'm learning from so many great fertility doctors around the country and the world, so many naturopaths, acupuncturists, herbalists. We're learning all together. Oh, low-dose naltrexone and CBD oil also for the unexplained infertility or unexplained repetitive pregnancy losses at any stage. I think it's big. And then there's a lot of chronic placental uterine inflammation. That's why I think the 2 to 4 week course of antibiotics, antifungal, antiviral, again, there's a lot of empiric stuff here. And then a hysteroscopy, D&C, clean things out, or go on to the laparoscopy, by the way. Normalized TSH, awesome. You can go ahead and pre-order that baseline, by the way, and get you moving forward. Any updates on when the Colorado location will be open? Satity, Chris? I'm betting 4 to 8 weeks. That's where my money is at. Because talked to Dr. Maggs and looks really good. The team is really excited, and so they might be up and running before Buffalo. But we're really trying to get Dr. Chang and Dr. D'Souza rocking and rolling in Buffalo soon. Oh, and Dr. Faruqi in Montreal is going to be coming down and helping us all once the borders open up. And diet can I use to help avoid early miscarriage? B. Cully. Slow it down and cool it down. Don't forget acupuncture, massage, and meditation. And put the vision boarding up of babies in your arms with your partner, your family, your friends. So don't lose that. But I really think that the immune protocol and the diet is amazing, and visualization. And it may be reasonable, things like intralipids, Lovenox, steroids, low dose, and the progestins can be really helpful, by the way. Everyone doing okay? Cool water. I got in my pottery studio tonight. I had a 10-minute little meditation nap before I had my steak and ice cream. I'm going to go to bed early tonight. We have a very busy rockin' day. We've got Dr. Luthringer, myself in Syracuse. Dr. Corley's going to be in Rochester. And then I might be out and I'll be in Buffalo and Rochester on Wednesday. But we got the team here rocking and rolling, by the way. And if you go, B. Cully, don't forget, go to either Amazon.com and you can download my magazine on Kindle, or go to our website, See My Fertility, or drkiltz.com, and you can get all that, by the way. There's no BMI restrictions in Colorado for the new CNY fertility, and I know Dr. Magarelli is really, really on that and excited about that. Remember, BMI is a measurement of the weight, but quite often it's an illusion, and you have to imagine and know that whatever size you are, shape, height, whatever it is, you're beautiful and amazing. There are so many women at every size conceiving and delivering babies naturally, and so there should be no reason that we should inhibit or restrict fertility treatments for anyone, by the way. We need to be open to helping people in this journey. My opinion is it's all inflammation. I've seen simply with the dietary changes, no weight loss, by the way, we've seen conception happen time and time again. I live in upstate New York in Skinny Atlas on the lake. I moved here from Los Angeles in 1995. Actually, I was in Berkeley for a couple of years, but a kid from LA, Silver Lake, and moved up here for a little bit of just a shift in lifestyle. Street kid from LA, Los Angeles City College, USC, UCLA for my fellowship in Harvard, UCLA, and really just grateful to have all the opportunities to be a little different places and learn about different cultures, different people, different environments, but we all must recognize that we are all identical. You open us up and the heart is in the same place, the mind is in the same place. We need to really emulate love and kindness to everyone, and we're here to do that in a much better way in the coming years. All right, faith is the only thing that has gotten me through this retrieval as the AMH. I know that 0.12 AMH. You have to be careful about claiming to know what these numbers mean. I've seen so many conceptions where AMHs were like, that's no way. Then there is the way. Have faith and be patient in the process, by the way. Callie Minaj, I apologize if I pronounced that incorrectly, but absolutely sometimes a DNC, if they're too vigorous and too often, but it's mostly the vigorousness can be more damaging to the uterus, especially if it's related to a later term pregnancy. So you got to be very careful with that, by the way. Hello, best shot. All right. Lovely lady, hello. Alyssa Mutz, hi, always a pleasure at Real Reads. Estrogen was only 244 on Friday with an ultrasound. Would estrogen pill be helpful? It's mostly the lining that I care about. The level of 240 may be enough to thicken the lining, but if the lining is still thin, add a little bit more estrogen. But don't forget PRP, aspirin, Lovenox, acupuncture. And sometimes we even use a little bit of vaginal or oral Viagra, mostly vaginal. Hey, Brother Ray, how you doing? Why is my passion in fertility? Chris San Martinez. Well, you know, it's kind of one of those things you sort of in this journey of life, you run into things. And I actually loved OB/GYN. I love delivering babies. And I worked at Kaiser Roseville with Dr. Kurt Klooster in 1990. And he did a lot of fertility. He had great passion for it. And I was just really, really inspired from the work he was doing. And from there, I went on to do a fellowship at Harvard, UCLA. And then I actually did fertility only, and I wasn't loving it. That's when I got back to OB/GYN, and I came up to upstate New York and started seeing my fertility. And from there, the journey grew and moved me from OB and GYN to just in the fertility journey, the health and wellness for all of us. And it just kind of blossoms. It's like that seed that you don't know when it's going to blossom or why it's going to blossom, but I just feel I find myself in the place that vibrates in an energy that I'm very excited about. And to see the joy when that thing you thought will never happen happens, it is amazing. And to go through the journey when it's not working and being part of the healing and the hopefulness and the journey that we all must go through, even sometimes when it doesn't work. And I find that is so important for all of us because it's through the mistakes, the problems, the fear, the pain, and the sorrow that we learn and grow together. And that's kind of part of the passion of all of this. And so I work with a tremendous amount of amazing people, and I've been just so honored and joyful. Maybe that's not the right word, but I think I'm in awe to see the people that are on this journey that just keep at it, and keep at it. So thanks for asking that question. What are the best add-ons for someone with endo currently on LDN? The Orlissa and letrozole for 30 days might be something for endo and the antibiotics, which suppresses the endometriosis, which I think is inflammatory. For sure, keto. And I think that's the anti-inflammatory things, lipids, the antihistamine protocol, pepsin, Claritin, and Benadryl. I think are really important. And if you go to the family building guide in there, and also in the patient portal, the resource guide, there's that simple guide that has the list that I think is really helpful. You have to ask for the embryo glue when you're getting ready. Hey, I want to do my transfer and I want to do embryo glue. You got to ask for it. Hey, I'm doing retrieval. I want to do a fresh transfer. I want to add the embryo glue. So you have to ask for these things, but don't forget, acupuncturists are back. We're praying that July 1-ish, we're able to get the massage therapists, the CMI Healing Art team, the whole front office team. Almost everyone's back, and we're really excited about that, by the way. PGNY, ZM, hashtag ZI, hashtag OSK, hashtag CRI. I'll have to look at that, Darlene. So thank you guys for sharing all the amazing connections that we're learning from each other. I see Dr. Kim Thompson from Miami's on Instagram doing a lot of stuff. But there are just so many amazing people that are sharing ideas. So keep sharing, and always grateful to everyone in the process. So just a couple more minutes. Timeline planning another IVF cycle after a successful pregnancy. Rory, how you doing? At least 3 months, I recommend. Might be 6, but it really is getting back to, get to the Keto Magazine, check out my book, The Fertile Secret, and my daily intentions. But remember, put the feline Ferrari, the lioness, and the Lion King in the right place, and look at what you did before. I always say, if it worked before, think about doing the same thing again. You don't necessarily need to repeat the HSG, the saline sono, but if what you did was successful, think about doing that. If you've gone from a fresh transfer to frozen, we want to keep it as simple as possible. Natural cycle FETs, and a letrozole or a Clomid trigger shot FETs, and we're doing a lot of mini protocols and dual stems also. And don't forget, ask about donor egg add-on. If we don't have the donor eggs from one of our banked eggs or fresh eggs coming, look at it, an agency egg bank. Bring your friend or a member of your family that wants to donate eggs, sperm, embryos, or carry a baby for you. We are really working to keep our pricing as low as possible. We're making a few little tweaks to a few things as we made some changes, but nothing significant. All really working to keep our payment plans. We're doing a 25% down if you pay, full 5% discount for now. Not sure when that's going to be pulling back. Hysteroscopy came back normal. Should I skip saline? If the hysteroscopy is normal, you don't need a saline sonogram, by the way. Now, hysterosalpingogram, where you look at the fallopian tubes, that might be helpful in the process, by the way. And I'm getting so many texts and calls and emails. I'm doing the very best I can, working 24/7, 365. I too need to take it slow and easy. We all need to do that from time to time, and sometimes I just have to shut it down for a little bit, by the way. Krista Stark, first ever FET, awesome. Endo removal, awesome. 4 of my embryos and 5 donor. HCG wash, yes. Don't forget about intralipids, Lovenox. Ask about the immune protocols. hey, I wasn't successful before, Humira, IVIG, and LIT are all additions. LIT, you have to go to Markham Fertility in Toronto or to Nogales, Mexico, and those travels might not be so easy. Normalized TSH, awesome. You don't have to wait. Just go ahead and ask for another baseline ultrasound and blood work. All right. Blessings and gratitude to everyone. Remember, we need to hold respect, love, and kindness for ourselves and everyone else in our universe. Everyone. God bless to you guys. Thanks for all you do. Oh, LIT, leukocyte immunotransfusion, husband, partners, white cells injected under the woman's skin. It's like an allergy shot. Although sometimes you can use some donor blood, but I don't know much about that one, by the way. I need to change, doesn't do, Nurse Carly, how you doing? Here to listen and learn and share some ideas with your clinic. They might be open to some new changes. All right, our cycles are being, listen, there's a little bit of kickback in cycles being delayed. It may be only a few days to a week, by the way, and I'm looking carefully. So, if it seems like I'm looking at it carefully, we're really moving most people forward. So I think there was a little bit of like too much of a push for delay when I'm going to look at it carefully. We're going to help people move forward, but there might be some days we have to delay a few days to a week at the very most. But usually we tell people a day or two or three or four at the very most, but we might carry that over with oral contraception in a few days. All right, guys, I love you guys. I'll likely see you tomorrow night, and but certainly I'm going to keep on working on Sunday morning at 10 a.m. Eastern Time and doing my weekly updates at 8 p.m. God bless you guys. I love you. Take care. Have a good evening.